Okay, today we are discussing about IV cannulation. So, why you need an IV cannula? It is a short-term direct access into vascular system. We can use that to give IV medication, IV fluid, and blood products. And also, we are using IV cannula to give IV contrast for diagnostic imaging. So, the equipment we need a gloves, we need tourniquet, we need cannula, and also at the same time we need chlorhexidine or alcohol soap to clean the area. So in patient point of view, you need consent from the patient, and you need to ask whether the patient is having any allergies prior to the performing the procedure, and also you need to make sure that patient is comfortable and warm. So next, the most important thing, you need to identify a good vein. For that, you can use the tourniquet method. Tourniquet, when you are putting the pressure, it should be more than venous pressure, but should be less than arterial pressure, not too tight. And you can just ask the patient to open and close his hand. By doing that, it will increase the venous flow to the hand, and that is an old method that used to do tap or rub the vein, but it can hurt the patient, so it's up to you. And you can just lower the hand to increase the venous pressure. You need to keep the patient warm, especially in theaters, because with the warm patient there will be vasodilate and you can easily put the cannula. And so what are the sites you can use? You can use the cubital fossa. The veins are much big in the cubital fossa, and it is very perfect for a resuscitation, but it's not good for long term keep in the cannula at that area, because the IV cannula at cubital fossa may kink with elbow flexion. And next site is dorsum of the hand, where you can have much smaller veins and good for longer access. Easy to access because the veins are much more superficial, and the issue can be maybe you can have tortuous veins there, but anyway it is the most preferable place to place an IV cannula. The next place I'm going to talk about is forearm. Forearm also good. You can have both small and large veins there, and good for long access, and it is much more comfortable for the patient. Then there are some other places here you can use. You can use the wrist, you can use the dorsum of the foot, and also you can use the saphenous vein also. Preferably better to put a cannula to the non-dominant hand of the patient, because it will be much more comfortable for the patient. Especially when you're putting the cannula, try to use the smallest size of the cannula need, and try to use the most distal vein. So I am telling like that is, if the patient is for usual antibiotic and IV fluid, you don't need much more large cannulas. But if the patient is come with a RTA, sudden accident, sudden collapse, which need much more blood supply, much more IV fluid, in that case you can consider putting a large cannula. And also, if you use the most distal cannula, if you fail the cannulation, still you can try with the more proximal one. If you try initially with the proximal one, you can distort the anatomy, and it will be more difficult to put a cannula for that patient. You can differentiate whether it's a vein or it's an artery. The most important thing to look is whether there is any pulsatility. What is the location? Medial cubital fossa, you can accidentally get the brachial artery, and also at the wrist there can be aberrant radial artery there. And arteries are much more deeper, and the blood flow will be very bright blood flow with high pressure, pulsatile flow blood. So in that case, you have to remove that cannula. Okay, then we discuss about what are the steps of cannulation. First, you need to apply the tourniquet. Then you need to bring all the equipments nearby, and you have to perform a hand hygiene prior to start the cannulation. Then always wear gloves, and as you have already identified the vein, you can just give a gentle tap over the vein, and you need to cleanse the skin with alcohol soap or chlorhexidine, whatever you prefer. And then you need to stabilize the vein and stretch the skin distal to the vein. This is most important to do the proper cannulation. And you need to pick the cannula with thumb and middle finger. That will be most easiest way you can pick the cannula, so you can stabilize it using your index finger. You can identify the point of needle insertion. You can pick up the straight veins, which will be most easy to put. Then approach at a low angle to enter the skin, then vein. You can use the angle of 5 to 10 degrees. Then advance needle slowly along the axis of the vein until you see the flash of blood, and then you have to lower needle until flat against the skin. This will prevent repuncturing, and then you have to secure the cannula using your plasters after removing the needle. Prior to you remove the needle, you need to remove the tourniquet, then occlude the vein proximal to cannula with fingers of non-dominant hand to prevent the bleeding. And then you have to remove the needle and you have to place that in the shaft container without harming to either yourself or someone else. Then you can connect the IV bunk to the end of the cannula hub, and then you can just flush the normal saline to ensure that your cannula is patent and it's successfully placed. Then you can secure the cannula. So the other important thing to consider, you need to make sure the personal safety, and you prior to putting the cannula, you need to think whether this patient needs cannula or not, and then how many goes should I have before calling for assistant. You can try 2-3 attempts if you're a doctor, and if you're just a student, you can go for 1-2 attempts without make that veins unusable. And then what are the complications? You just can cause pain, distress, you can cause the hematoma, and you can make the nerve damage, and you can prick an artery. Then what are the contraindications? You need to avoid if there's a future AVF patent, and if there is a lymph node dissection which was done earlier. Okay, so I'm ending this with the different types of cannula. We have several gauges. 24 gauge, which is the smallest one, the flow rate will be 22 ml per minute. Then we have a blue one, that one 22 gauge, the flow rate will be 36 ml per minute. And then we have pink one, that is 20 gauge, 61 ml per minute will be flow rate. And we have green one, which is 18 gauge, 90 ml per minute will be flow rate. And then we have a gray one, 16 gauge, 180 ml per minute. Then we have orange one, that is 14 gauge, which is 240 ml per minute. So you can see by seeing the sizes of the cannula, you can go for a smaller cannula like 20 gauge if you just want to give fluid and IV antibiotic insertion. But in the place like where you need to resuscitate the patient need lot of fluid, lot of blood products, in that sort of case you can go for 16, 18, 14 gauge cannulas. I think you have understand the thing properly. So we will meet with our next video. This is the practical session which is important to work as a doctor.